Bismillahirrahmanirrahim. Today we will have case quiz number 32. Case data: 17 years old male, a boy 17 years old. He is marathon runner. He presented with pain in the right buttock that radiates to the upper posterior right leg. By examination, tenderness with palpation of the central buttock and hip extension. Deep tendon reflexes and sensation are normal. Treatment: the patient responded well to non-steroidals and rest. So the case is acute and responded well to non-steroidal and rest. The patient is marathon runner. He presented with pain on the right buttock radiate to the upper posterior right leg and tenderness with palpation of the central buttock and at hip extension with normal deep tendon reflexes and normal sensations. So what is the diagnosis? The answer here is, I think you will answer correct. Yes, the answer is piriformis syndrome. Piriformis syndrome. For those who don't know what is piriformis syndrome, we will explain briefly now. Piriformis syndrome is seen in endurance athletes. The piriformis muscle is located adjacent to the sciatic nerve and is the muscle aid in hip and leg extension. The syndrome will mimic sciatica, so the history is the key of diagnosis. It is usually respond to rest and non-steroidal anti-inflammatory drugs. So piriformis syndrome is inflammation of the piriformis. It occurs especially in endurance athletes, and so the patient should be interviewed well, and the history should be taken good and thoroughly in order to not to confuse with sciatica. In sciatica, there is sensory abnormalities, there is radiating pain, and will not respond to rest and non-steroidal as in this case. So this case is piriformis syndrome, which is one of the acute cases in rheumatology. And thank you very much for your attendance, and see you again tomorrow with case quiz number 33. Wassalamu alaikum wa rahmatullahi wa barakatuh.